Wish everybody a happy All Saints Day. And we'll get started with Section 2 of the 2018 County Executive Budget. First up on page 306 is the nursing home, and we have Larry with us tonight. Thank you, Larry.
Thank you.
For coming. You want to give us a brief?
Thank you for having me. I'd like to start out by saying it's been a very productive year. Two of our highlights is one, receiving our certificate of need approval with the renovation construction of $60,450,000, of which over $58,500,000 has been approved by the health department, even though we could go to $60,450,000 for this project. The estimates have come in from our construction manager below what the health department has agreed to reimburse us. So right now, we're in excellent shape. The second highlight is having one of the better surveys than we've had, probably in the last decade. We've had no care issues in that survey, no harm to residents during that survey, and most of the deficiencies were K-tags, which are life safety, and that will be cured with the renovation, which hopefully will start early next year. On the still challenging side is obtaining the staff that we need to fill our open slots, but because our census, which is another challenge, has gone down from an average or budgeted average of around 220, and the most we could go to right now is 240. We've been averaging somewhere around 208, 210 a day. So that's a challenge, filling our beds. We're getting a little better over the last few weeks, so hopefully that'll improve, and it's happening throughout the state of New York. That doesn't mean anything to us because we want to fill our beds, and we're focused on what we need to do at our nursing home. So we deal with that every day, even though it is a challenge. With the empty slots that we have, vacant slots in our budget, we're able, in a way, to control expenses to census. So even though it's been a challenge, these two challenges kind of offset one another because you have empty beds, and because we have vacant positions, we now do not fill certain positions, okay, so that we offset the revenue that we're not receiving. If we start receiving residents and fill those beds, then we'll work more diligently in filling vacant slots in the nursing department. But right now, we have sufficient staff to care for the residents who are living there. Looking at revenue from 17 to 18, we're showing almost a $2 million increase in revenue, and that's due to case mix primarily, where we've done a really terrific job, the clinicians at the nursing home, with the help of Zimmet, who you have approved year in and year out, that work with us on our case mix and documentation. Our current case mix is around 1.09. We just got our new Medicaid rate, which is in excess of $229 a day. It should be noted that when I started in 2014, the Medicaid rate was $175 a day. That's an increase of almost $55 a day times 66,000 Medicaid days. So it's significant revenue increases over the years. We've also been able to manage expenses, and just looking briefly, even though this is very fluid from 17 to 18, we're budgeting spending less than the year before of somewhere between $600,000 and $700,000. So with the increase in revenue, the decrease in expense, we're showing an improved bottom line. Again, very fluid, and it's a budget, not what will ultimately be the reality of somewhere around $2.5 million, $3 million better to the bottom line in 2018. And that's the overview that I have.
That's a very, very good accomplishment.
Well, thank you,
because
Gary.
it was the other way.
Yeah.
That's in the black? Is this,
Yeah.
in the black in 2018?
No, I don't think so. I think
what's that telling you?
there is. You want to?
So, if you were to consider all considered operationally, they'd be breaking to the even point. That's excluding your IGP contribution that is made from somewhere else in your legacy healthcare. That is another portion.
So you put those two things together, that's somewhere between $4 and $5 million. You don't have to, but in order to get the drawdown to the IGT, you spend 50% of what we're going to get. So that's a mandate in order to get the dollars. So our IGT in this year, because we got past years into this year, is almost $16 million, over $16 million. So the IG contribution is $8 million. But for this year alone is $9.8 million, so it was $4.5 million alone, that contribution.
You all set?
Yeah. Thank
Mr.
you.
Kraus?
Thank you, Mr. Chairman. Larry, since the legislature made the decision to keep the nursing home and brought you on board, the advancements have been extraordinary, and I think you're to be congratulated for that. I know you've got a great team out there.
We do.
On the capital plan, you mentioned that you've been approved for the 60 million or 58 million, but that the proposed budget is even less than that?
The numbers that came in from the construction manager with soft and hard costs is approximately $200,000 less than what the health department approved for our project, as we speak today.
Good.
And that includes contingencies. So the contingencies alone are over $7 million, which represents part of that 58 million. If you took the contingencies out from the construction manager, we're looking at about 51 million. You put the contingencies in, it brings you up to 58 million and change. The health department is also giving 58 million, plus around $200,000 more than the construction manager is saying the project's going to be.
You can't get much closer budgeting than that.
We're in pretty good shape right now.
Thank you. Thank you, Mr. Chairman.
Mr. Miller?
Just one question, just the IGT you're talking about, is that the same thing that we've been paying for these residents who are going to another nursing home? Or is this another number? Seems like it's a lot of different numbers.
IGT is intergovernmental transfer. Only government entities, healthcare entities get that money. So because we're a government entity, we get IGT. If you were a hospital, as an example, and we're a state hospital or a county hospital, you would also get IGT, as an example.
So these are not the Medicaid reimbursements and we will be paying?
No,
to-
this is almost what one could say, to make it like a mission payment, meaning you're getting intergovernmental transfer from the federal government and the state to offset expenses that they believe traditional nursing homes and healthcare facilities do not have. We have expenses for who we care for, and that other nursing homes do not, and just like hospitals, whether it be indigent care, people with no income. So they created the system of intergovernmental transfers where you get money from the federal government to support those programs.
So these are beyond the county's Medicaid share?
Oh, it's beyond that. So if we have a Medicaid rate, as an example, which I've just mentioned, of $229 a day and change, starting January 1st, we will get $229 and change. And in addition to that, we get IGT. Our IGT this year was 9.8 million. When we went 3 years ago, it was 6.8 million. That's gone up by $3 million.
Mr. Clay?
Yeah, Larry, I certainly like to add my accolades to you for the job that you've done out there.
Well, thanks.
We probably beat up on you enough, but you really have done a magnificent job out there.
Well, thank you.
And so certainly, I thank you for that. Just a few questions. You've added a position of senior security guard, and you deleted a security guard position at $28,770, but that security guard position still shows is still funded in the budget. Why is both positions still in there?
Talking about the first line, the Director of Security?
Well, I'm at the, I didn't get to that one yet. We'll get to that one.
All right.
Now, I'm talking about the one where you have,
Oh, the other we changed.
you added a senior security guard, and you deleted another security guard position. That's line NH 6020, but that position still show in the budget.
Okay, so,
Page 308, Larry.
308, that's what I needed, okay.
308.
So right now, we created the 2 part-time positions, you see those? We created 2 part-time positions that were not there the year before, at 14,386. We created those to eliminate overtime. We had a built-in overtime because we did not have enough staff members to cover all the shifts. So if you have 1, 2, 3, 4, 5, which is the supervisor, okay, and you have 3 shifts, you have 1, 2, 3, 4, you need 5 FTEs to cover the shifts. And then with their days off, that's why we have the new 2 part-timers, and now we can cover the nursing home 24/7, which we weren't able to do before.
Well, you're paying overtime.
Yeah, we were covering it, but with overtime.
Oh, okay.
So now the whole idea of having this type of schedule and people budgeted, it eliminates that halftime. Even if someone takes a vacation, it's overtime. If someone was out sick, it's overtime. If someone had to work a holiday, it's overtime. And then we didn't have enough shifts, enough coverage for the open shifts, so that would be overtime. If someone wanted an LOA, it would be overtime. Now with the part-timers, we can now use them and hopefully eliminate overtime. So when someone takes a sick day, we call in the part-timers who can each work 3 days each. And it still wouldn't be overtime.
Okay.
Mr. Higgins?
Larry, the overtime is going up here in your budget. I'm just curious to know what you attribute that to.
Yeah, the overtime has gone up, and that's one of our challenges with staffing. That one of the built-in overtimes was security. We had that overtime. And also per diem has gone up. As an example, we staff for each position that's required with no, and if you're going to use a per diem as an example, so right now, let me give a better example. The occupational therapist is on maternity leave, and she's going to be out for a total of 4 months. Our per diems are now covering that. So when the per diem covers, which wasn't anticipated, her being out 4 months, the per diem line went up, 20%, 25% more than we anticipated. We're using overtime, I would say primarily in the nursing department. We had, during the course of the year, which I mentioned here, probably around 35 to 40 open slots in nursing. So between RNs, LPNs, and CNAs, the overtime probably went up above what we anticipated by around $250,000 to $300,000. What we did to fund it, we took the vacant positions and moved that money to fund the overtime. So it didn't cost us, it really cost you more because you're paying half-time, but it really balances because all those other slots, if we filled them, you'd be paying benefits.
Yeah, sure.
So benefits for a $30,000 employee is $24,000 a year plus, almost 100% benefit package. So even though the overtime has gone up, overall, the expenses have gone down.
Do you have any plans to try to reduce it or hold it at the same
Always.
level?
Our goal is always to reduce overtime, minimize it to zero. I mean, our goal is zero. We did ask for agency approval, which we received this year, and we thank you for that. We've been working with an agency now for over 9 months, 2 different agencies. One we started, stopped, started a new one. It just doesn't work. It's just not working. They have the same problems in our area that we do. And the only thing is they're recycling people, and they're not providing the care that we need them to provide, and there's no dedication and sincerity to the day-to-day operation. So by the end of the year, we've made an internal decision to stop using all agencies, go back to using our own staff and only our own staff. It may mean that overtime may remain where it is, but we'll provide better care with our staff, okay, and be able to control it, and then hopefully continue to work on filling positions. We're working with BOCES now, we're working with Glenmont, we're working with SCCC and all of their CNA programs to try to get people to work for us. The nursing situation's actually pretty good at our home. We have maybe around 6 FTE openings. Last year at this time, it was probably over double that. But if you remember, we changed the structure of the RNs. We did what we needed to do. We funded it with giving up other things. Every one of those positions are now filled, every one.
Great.
So we're
Mr.
moving
Bergdorf.
forward.
Larry, I'd like to go back to the intergovernmental transfer. You had mentioned, correct me if I'm wrong, that in the past we got 6 million in change, and this year we're expecting 9 million.
In, I believe, 2014, I don't think that's in the book anymore, it was $6.8 million.
And what is?
This year is 9.8 million.
Okay. Are there any criteria that are under your control which drive that ratio or that funding stream, or is that strictly a pass-through based on some pro rata portion from the state and federal government?
The latter, for the most part.
Okay.
If we get a specific percentage, our percentage has usually ranged around 3.4% of what the New York State has decided, along with the feds, to give us to distribute, correct? So let's say, for argument's sake, in 2000, and then, by the way, there were more nursing homes that were run by government. So there was more money, and then they distributed it to more beds. It's all done on a per-bed basis. Our percentage, as stated, has been more or less the same, 3.4%. However, from 2014 to now, it went from 290 million to next year being down to, I think, was it 367 million. So they lowered it almost by $80 million. Okay, 80 to $90 million, the total distribution. So we're still getting 3.4%, but of a lesser amount. So we're expecting, and we're really anticipating this in the budget, that even though we got $9.8 million this year, we're expecting next year it probably would be less.
That was my question, is how much less do you expect?
Right now, I think it's going to be around $1.6 million less.
So you'll be starting with a hole for next year.
Well, we're anticipating that, and we've been working with management and budget, management budget to try to make sure that we're going to lower expenses to compensate for any decrease in IGT. Now, what happened is also, which I mentioned, we got basically what one would argue is retroactive payments. They paid us 15, 16, 16, 17. So where we expected to receive $9.8 million this year, we received over $16 million this year. Okay, but that also has to pay for debt that we created for those years that we didn't have that money. So Sean's still working out the numbers. We will see exactly where we stand, and then we'll adjust whatever we need to for 18 to make sure that we have as close to a balanced budget as possible.
Lynn, did you have a question?
I'll pass. No, I'm good.
I have
Ms.
a
Cunningham?
question.
Sure.
On the IGT, going back to that, that's Medicaid money though, right?
It really comes down from the feds.
But it's
Separate.
Medicaid, so,
It's separate.
It's really not Medicaid money. It comes through the state,
right?
and it doesn't come in our Medicaid rate.
No,
It's
I
a-
understand, but I think it is a funding stream that comes out of the Medicaid program.
I don't know that to be,
We gotta have a look at that.
I would have to look that up. I know it comes from the feds, and that's why we deal with these upper
Right.
payment limits, and
Right,
they
that's
use
all
all these
Medicaid.
different calculations. But you could, if you're a government entity, and let's say you're a hospital, okay, they're giving you IGT, but it's not necessarily for Medicaid. It's like a mission payment to deal with the uninsured, residents who we care for that traditionally would have a lower case mix,
Yeah.
but we're caring for them, where other nursing homes wouldn't
Right.
admit them, to compensate us for
Right.
that. Is it part of the Medicaid program? I don't believe so, but I think we need to check.
And the reason I ask is because IGT funding dollars have always been controversial for years and years
Yes.
and years in federal Medicaid budget discussions. So one of the big threats in the healthcare space is obviously efforts or policy proposals that would take Medicaid and turn it into some kind of per capita cap, block grant type of thing where the state of New York would get a lump sum. But I believe that the IGT money is also at risk in those policy changes. So I just wondered if you're kind of plugged into that discussion, because that's a big dollar.
Both of the things you said are totally true. They're looking at a cap and how we're gonna get our Medicaid dollars, like our $229 a day rate. They're looking at putting caps, and IGT is always at risk.
Right.
And that's why it's imperative, that our project, as we're
Right.
moving forward to renovate our nursing home and go to a modern nursing home, a 250-bed nursing home that could hold 250, and we operate at 250 to make up those dollars. Right now, we average around, if you think about it, 35 to 40 empty beds a day. Okay, that's around $12,000 lost revenue a day.
Do you have a lot of private pay patients, or is it mostly?
We actually have surprisingly around 12, 14 average private pays, which is, sometimes I say, that's a lot for us.
Yeah, it
But
is.
we actually average pretty well in the private pay census.
What's the bed count? I'm sorry.
Right now, this morning was 208.
Doesn't it usually hover around 230?
220.
220.
And I did mention that it has been low, and the industry has been low. I believe that we're picking up a little now. We do have highs and lows.
Is that because more people are trying to stay in their home, if we're trying to keep them in their home, which is more cost-effective for the county taxpayer? People just love living home more than nursing homes anyway. So the goal is really probably not to push more to the nursing home, but try to keep more in their home.
True.
So that's going to affect the rate. But we have other avenues, as you're talking about, through therapy and other programs that will be
Exactly.
often.
That's why the case mix is
Adult
so
daycare, other
important.
things like that, we can generate revenue, other revenue.
Exactly.
Are there any other questions?
Yes.
Mr. Grimm?
Thank you, Mr. Chairman. In the overall budget, there's a pretty big jump in debt service, 5.3 million. I'm sure some of that is for the renovation of the nursing home,
Yes.
but isn't it true that a good chunk of it's going to be reimbursed by the state? So how would that affect the debt service then?
It will, when it's all said and done and the project's over, that's why we're trying to get started as soon as possible. When the project is over, all of the debt service, the interest on the bonds will be reimbursable through the health department, 100%. The struggle that we're having now is that if you borrowed, which we did, over $20 million, and you only used $4 million, let's say, as an example, and it's around that, which we did use, the health department's only gonna reimburse you the debt service on the $4 million, what you spent. So the $16 million that's sitting in the bank, you're paying for it. So until you use it, you can't get the debt service, okay? And then the capital that you're spending, which is, it comes back to us in the form of depreciation. So the 20 million that you spend in total becomes a capital expense. You get that back in depreciation. You get all that money back as well. So the capital, okay, along with the bond interest, covers all of your debt. So until you start the construction, until we get the construction done, as long as the money's sitting in the bank and it hasn't been spent, the health department doesn't recognize it as an expense, and you're not getting reimbursed.
We anticipated that too, just so you know.
That is correct.
Yeah.
Yeah, absolutely.
So it's going down as an expense, but the future, the
Oh,
likely...
it's gonna be paid for.
Yeah, eventually it's not gonna cost the taxpayers nothing.
That's
in the
right,
end,
it's gonna be
when it's
paid
done.
for. But, by the way, we have an obligation to cover that debt with our day-to-day, budget. We understand, as a matter of fact, I just met with Sean today to go over what that debt service is, and we're figuring out a way to cover that debt during the 2018 year, until it becomes a reimbursable item.
Now, you say you're down to 208 today, and you want to go up to 250 with the reconstruction, but where are you going to get those folks if a lot of them are trying to stay in their homes, et cetera?
Well, census is fluid, our budget is conservative at 220, that's our budget. Our goal is to go to 220, stay above 220 in that area. This is the first year, in all honesty, that we haven't been able to do that. So we meet every single week, we have a little team together, it's called our admissions team, and we're working on different avenues to receive residents. We just work.
What's gonna be a new nursing home? It's gonna be, it's gonna be a waiting list. Instead of the 60 people that are going over to Western Mass and everything and traveling back and forth, they're gonna wanna do that.
Correct me if I'm wrong, Larry, but in Albany County, there's not a lot of excess bed capacity for nursing home beds,
That's true.
right?
We're gonna be fine,
Yeah, I think
we're
so.
on target, we're doing what we need to do, we're controlling expenses, we're working on revenue. When we don't have the census that we need, we don't just continue to spend money as if we had 220 people in the house. We cut our costs, we look at our staffing patterns, we balance the budget.
Mr. Kraus, thank you, Mr. Grimm.
Thank you, Mr. Chairman.
Just to follow up on Mr. Grimm's question regarding the $20 million. If by some chance we don't spend that entire $20 million, is that a possibility?
No.
We will spend it all.
Oh, the project's slated at over 58 million.
So we don't run into a situation where we have to cover any gap. That can-
Definitely not. Matter of fact, we're working and did work, we're already done with the construction manager, with the architect, and with Sean's office and the controller, deciding exactly how much money of the 40 million which you approved, we're gonna take to make sure that we don't put money in our bank that sits there that's not reimbursable. So even though we have 40 million, we're only gonna seek probably another 20 million to the 20 that exists to make sure that that's not gonna happen.
Thank you, Mr. Chairman.
Ms. Cunningham.
Okay, just a tiny little question. What exactly is the Greater New York State Education Fund?
That's your union.
That's our union.
Okay, I thought,
Okay, so there's a part of the collective bargaining agreement for the 1199 union out there is the contribution of, I think, 0.5% of your
We do the
payroll.
education fund, they have a child care fund, they have like 3-4 different funds, and then the normal union dues. But they have these funds. 2 of them is child care and education.
so what does the education fund do?
We contribute a percentage of, they do have education available to come into the nursing home if we wanted it. They do post when educational programs are being run. Clearly, if you probably took all of their members in the state of New York and how much money that 0.5% generates, I don't know whether, it's good value for the contribution, but it is what it is.
It's
part of the
negotiated.
contract,
That was negotiated in
and
the
it's-
contract.
That
so
is correct.
We're just living up to our obligations.
There you go.
What's the Director of Safety Security? That's a new position. What's that?
That's a position that we funded by giving up 3 other positions. We feel that with the construction that's going to be going on at our property, that again, hopefully will start in the beginning of next year, we're going to have probably 50, 60 workers on property coming in and out of the facility. They're going to be working outside, inside. We do have 200 residents living there, families coming in. We want to make sure that we have an extra layer of security to make sure that everyone is properly wearing their badges, doing
You don't have
screenings.
anybody doing that now? There's no supervision of these security people out there?
Our security guard is stationed at the front desk and doesn't leave the front desk. There's no rounding, we're not checking the property. We do that after hours because we lock down the building, but it's really not, this is all going to be happening on the day shift. I guarantee that we'll have 50, 60 workers in the building renovating the basement, up the elevators, down the elevators.
Yeah, but this is a director's position, so this is a management position.
This is going to be the person overseeing the entire operation that will also be able to monitor the front desk, teach the other security guards
The
what to
front
do.
desk has one person. How many
Correct.
security guards we have?
This-
4 in the budget.
Yeah, there's 4 in the budget. This
Four?
is,
2 parts.
and 2 part-timers, that's
Five.
24/7.
7 people?
Well, the 2 part-timers only work 2 days a week each, so we have the full-timers, okay? If they all work without the part-timers, we wouldn't have enough.
But who's supervising them now? That's my point.
Yeah.
They report to you?
Yes.
Okay. Mr. Clay?
Larry, are you saying you only
He knows-
have-
He knows more about security than anybody.
I won't say that, but I have spent half of my life in the business. So you only got, how many security guards you have out there now?
You have 4 lines, I think. Do you
This-
have 1 vacancy or no?
There's 4 lines right now, but we do have a vacancy. So there's 5 altogether, I believe, right? Didn't I just say that?
Is that really sufficient, given today's,
That's why they're creating a hierarchy here. They run 24/7 also.
Yeah, and that's why we're doing this. We can get by the way we are now, because we're very self-contained and we can lock the building down. But when we start doing construction, every one of our wings are going to be under construction because the new building has to connect to the existing building. We're renovating the entire basement, which will be open to the outside. We will have cameras, we will have better security, but this is somebody who's coming in that's better trained to supervise our people, understand what it's like having 50, 60 workers, construction workers on property every single day. It's going to be a massive project, and I think it's going to be money well spent, having someone oversee the operation.
Larry, my point is that it seems to me you're top-heavy and you don't have enough. You have a lot of chiefs, but you don't have that many
No.
Indians.
The senior security guard is one of the guards. He has the title of senior security guard, but he's one of the people that sit at the front desk. He is not, in a sense, a security guard that walks around and manages. He's a working administrator, so to speak, meaning by title. His real job, when he comes into work, he's the only security guard in the building. There is no other. This is going to be the first manager that we ever had.
Mr. Miller?
Another question. The medical director, you've got, looks like there's no pay raise in for the medical director, is there some reason for that?
The medical director is part of the NICET unit out there, the teachers union, and they are still in negotiation.
We're negotiating with them now. Right now, anyone in the NICET union, their contract expires December 31st of this year. We're in the middle of negotiations with them. So once that's determined, it'll be an RLA, it'll be presented to you, and at that time, the medical director, along with their other members, will receive their increase.
We have a part-time nurse out there at $20,176, and it's going to $34,687. Do you know why that is? And then, because the other ones,
Nurse
all
part-time?
the other part-time nurses got 2% raise.
Do you have a 4-day part-timer?
It's your line,
It's 307.
640094 on page 307.
This one. Do you have a 4-day part-timer? I have to get back to you exactly.
Yeah, I don't want to say if I don't know,
Yeah,
but that's a legitimate question.
In all those vacancies that you have in here, you're working in to offset your expenses towards the low count. Are you looking to fill any of these vacancies where we need them?
We're not looking to delete any, and we're looking to fill them as the census is where it needs to be. Right now, we have 9 CNA openings, as an example, that I need to fill, that I haven't been able to fill, but I'm working on filling. But if you did a count here, you would see that I probably have a total of over 20 CNA full-time openings, along with the part-time. So we still have a very big cushion there. I only need 9 to get to where I need to be. So, but if the census grows, I may need 10, I may need 12. Clearly, as we move along and we start opening up beds to get to the census that we want to be at with the renovation, then clearly all of these titles will be required, all the line items. I want to note that even at a 205 census, or 208, 210, which we average around today, going to a 250 census every single day, this staffing pattern that's in this book would not increase by 1 hour, meaning every CNA line is for a 250-bed nursing home. Every RN line, LPN line is for a 250-bed nursing home. So we would not come back to the legislature and say, oh, by the way, we now have 250 beds, we need 3 more CNA lines, or we need 4 more LPN lines.
No, but we shouldn't be paying for all these CNAs and nurses and at a 206 level, because we're not going to be at a 250 for another 3 years.
100% correct, and that's why we're not filling these lines. They're here, we know they're here. If you look at the 2017 budget and compare it to our expenses for payroll, you will see that it's probably somewhere, without benefits, around $2.5 million, $2.6 million below the budget.
Any other questions? Ms. Cunningham?
I noticed in here that you did have a wound care nurse in here, but it's listed for $1. What exactly does
Yeah,
that mean?
the nursing home used to have a wound care nurse.
Right,
We eliminated that position, but we keep the line at $1 because we don't want to eliminate the title in case
Okay.
at some point in time we need that title.
okay,
But that is now being done by the medical director, who we added to our staff a few
Okay.
years ago, director of nursing, and the infection control nurse.
Okay.
They go on weekly rounds as a group versus one person doing it. We now have a team that does it every week.
Okay.
And they're our wound care team versus
Okay.
having a wound care nurse.
okay. Because I would imagine that, that pressure ulcers are probably one of your biggest challenges to avoid.
No
And
doubt.
having somebody with that level of expertise in wound care, I would imagine would be a huge asset.
Oh, definitely. And, by the way, the person in that title still works for us.
Okay.
So she's
Oh,
still,
so they have
yeah,
that
she's still there.
expertise.
Okay,
And
she's
do
one of
many
our nurse
your-
supervisors.
Do many of your nurses have unique sort of specialty training in, you know, the post-acute setting or in wound care or in, you know, different types of,
The answer is specialty care, no. But matter of fact, we just registered the director of nursing to go to a wound care program and infection control. That will be a 5-day program, very intensive.
yes,
She's going to that, and then we have another program that the ADNS is going to, also on infection control, where she's going to get that new classification. It's a CMS mandate. By next year, you have to be classified with that infection control. I'm not sure the exact initials, but Michelle, who's the ADNS, will be going to that program. And it's actually not going to, it's an online program.
okay.
It's something like 100 some odd hours, and she's already registered to do that.
Great, thank you.
Are there any other questions? Thank you, Mr. Slasky.
All right,
We
thank you.
appreciate all your candid answers.
All right, no problem, thank you.
Next up will be aging.
Gary,
Yeah, yes.
is there any reason why we can't be in a bigger room?
Good question.
You
You have
know,
a
it'd
bigger
be
room?
nice to have all of our peers at the table, and then we've got this people hanging out there waiting, and I just, is there not a bigger room we can use?
The other one, yeah, I guess cow room.
We used to do it.
I know sometimes they have programs in there, but if there isn't, it seems kind of silly.
I second that.
Yeah, but, well, if it's available, we'll look into it.
Congratulations, your kids.
Did you see that?
We have Scott.
So funny.
How are you, Scott? Thank you.
Chairman, thank you.
Page 70 for aging. Scott is sitting in for us tonight for the aging. The director hasn't been appointed yet.
Thank you for the opportunity. That is correct.
Many talents. With you.
Do you have any opening remarks, or?
You know, things are very, very busy in the Department for Aging. A lot of changes occurring this year. We've seen our fair share of challenges with the new statewide data collection system, with a home health aid shortage of crisis proportions, and some staffing changes, as everyone here is aware. But we're plugging right along from a budget perspective. We don't expect too many changes between last year and this year. Everything is pretty much status quo as far as that goes. We have managed to lower our county share this year by about 8% from last year. So a good 60% of our operation is grant funded.
Are there any questions? Mr. Higgins?
Did any committee members have questions first?
Mr. Graham?
All right, thank you, Mr. Chairman. Yeah, the top two lines right away, there's a big raise for the commissioner, looks like about $16,000, and there's the creation of an executive deputy commissioner at $78,000. What's the justification for those two?
As you'll see later on tonight, we'll have the DSS group speak here. This is neutral with, and building a hierarchy within aging to make it function at its topmost epitome that it could. Not saying that it's not, but there are opportunities out there that may be able to expand what we do there. Likewise in DSS, the deputy commissioner in that group will be like basically a transfer for that. So overall, countywide, it's neutral. But it shows more in aging and less in DSS. I think.
There's a corresponding reduction then in DSS, is that what you're saying?
Yes, and that,
That's why I'm being
so,
good.
thanks.
That's all good. All right, thank you. Yeah.
Mr. Higgins?
Yeah, I just kind of want to follow up on what Mr. Grimm said and what Mr. Clay said with the nursing home. It almost seems like for such a small agency, it's very top-heavy. You have a commissioner, now you want an executive commissioner, there's a fiscal director in here. You know, we're only talking about 9 FTEs as it is, and several of them are, you know, contract administrators and account clerks. So to me, I find it hard to justify that additional request for an FTE here. And so I guess I'm curious to know why that's even necessary.
Are you referring to the deputy line?
Yes,
Okay.
that's a whole new line. I mean, with French, that's
The
going to be.
last year has been quite eye-opening. I'll speak somewhat personally if I may. It's been quite eye-opening. That department is incredibly busy. The commissioner for the Department for Aging is generally out and about frequently. There has not really been a full-time director in the department to oversee the day-to-day operations. And we've been able to streamline that more recently with the folks that are there. And what we're doing is basically taking the system that's in place now and formalizing it for next year's budget, where it hasn't been formalized previously.
Who's the commissioner now? It's empty?
Presently, it's vacant, yes.
And then this would be a new position, so it would be 2 top positions that are empty.
Well, you'd be taking the commissioner and increasing it to commensurate with a deputy commissioner in
Sure.
DSS, and then having a secondary,
Which would also be new.
that
Because in
one
the-
would be new.
Yeah, in the paperwork that was submitted, it says here to create a clear chain of succession. And there's already a succession issue, so I don't see how creating another position really helps that. I guess that's my concern. And I'm also, I mean, it would be easier if I saw some more, if we're gonna overhaul a department.
Would you like to see the whole transaction? We could probably give you that breakdown.
Yeah, I would be interested to know specifically what we're talking about.
Send that to Pat. We'll get it-
I just
we'll
have
get it
one
arranged.
follow-up, but you can come back to me if you want.
No, finish up.
So just another question on the vehicles. It lists who has them, and it seems like almost everybody in the department has one.
There's only one vehicle.
Oh, there's
They
one
all use the
vehicle.
same vehicle, correct.
Got it. This Ford Focus.
Ms. Wilhelm, do you have a question?
Good, I guess mine.
Wanda?
Oh, yes.
What's it?
I just have a question in regards to past policy and that there used to be dollars for wheelchair ramps for people. And so I was wondering, you know, is there any way that we can move back to that or?
The short answer to your question is yes. That is something we've been discussing at great length in the department lately, using ISEP for ancillary services, combined with the senior housing program that we've been very successful in ramping up, no pun intended, but ramping up. Yeah, I think you'll be seeing more of that in the very near future.
Okay, thank you.
Ms. McKnight?
Yes, thank you, Mr. Siegel. Could you explain to me, if you were in the director's deputy commissioner job, is Mr. Brown's item still here, Commissioner Brown, who used to come to our social service meetings? Is it one of these items anticipated for him, or it's just for you and a new person? I'm confused.
For me and a new person.
Okay, thank you.
Mr. Kraus?
Thank you, Mr. Chairman. So, how long has the commissioning position been vacant?
Since, I want to say August? 2 months. August, yeah.
All right, so you're going to come in under budget for that plot,
Yes.
obviously, for the year. And as far as the $78,000 figure for the new deputy commissioner, that's an annual figure?
Yes.
When do you anticipate having that person on board?
As soon as the budget's passed.
As soon as practicable.
Okay. January 1st.
At the earliest, I would say.
Thank you.
There's a confidential secretary pay raise over 2%, it's actually 8%. Is that coinciding with your DSS reshuffling, or why is that?
I'd have to look at the collective bargaining agreement. I think that was settled in the collective bargaining agreement, but I'd have to get back.
This is a confidential secretary.
No, she's not in.
Okay.
That was a
They keep secrets.
request the department made on behalf of an individual who is a very long time employee in that department, 14 years, I believe, 13, 14 years. And we have looked at expanding her roles in that position. She's gained a great deal on her plate in terms of workload, and we would like to attempt to compensate her more fairly for that. That also represents about the median level of confidential secretary salary across the county.
Are there any other questions? Thank you, Scott.
Thank you very much, Mr. Chairman. Thank you.
Next one up would be Human Resources, page 129. Jennifer, thank you for being with us tonight. You want to just, do you have any, nothing?
There's no major changes to our budget, so I'd be happy to answer any questions you have. Let me say that.
Can you guys keep it down in the back? Take it outside. Go ahead.
Drop that hammer.
We have no major changes to our, the human resources budget, so I'd be happy to answer any questions you may have regarding that.
Very good. Any questions for the commissioner? Thank you very much for coming tonight.
My goodness.
Next up is Social Services, page 180.
I think you're right. Oh, wait. Do you have a question? Yeah. Bring it back.
Michelle, is it?
Yeah.
Page 180. Thank you, Commissioner. You have a brief,
And that's the compliance officer? Because that was zero.
Thank you.
do you have a statement or anything you want to say? Open it up for questions.
Just overall, we're requesting a budget of $131.1 million. $66.4 million of that is our Medicaid share required mandated payment, leaving us with a $77.5 million local share, which is about a 2% increase from last year. That's just the highlights. And we are just, as you, from our response to the memo, you can see we're shifting around a few positions to shore up our work and our infrastructure and our succession planning.
Thank you. Are there any questions? No questions?
Stand on the side.
Ms. McKnight?
Yes, thank you, sir. I'm Michelle, Commissioner, I'm sorry, Deputy Commissioner. I'm concerned about the Deputy Commissioner position that's going to be eliminated. Is that someone that's on staff, or that's creation of a new person, or what? Could you help me?
So that is part of the aging transfer of function
That
here.
we just
So
spoke about earlier?
yes,
Okay.
to build in this hierarchy to keep our seniors in our homes whenever that's possible, and to operate with that.
Now, all of these new shifts that we are speaking about, have they been through the Human Resources Department and called exempt civil service jobs, and they will be advertised to the general public about vacancies in our government?
Yes, we don't have all of them civil service approved yet. The Director of Adult Services has been approved. The Assistant Director of Social Service Programs is an existing civil service position, and the Assistant Director of Child Support was approved, and Administrative Assistant is an existing position as well.
So prior to approval, they're in the budget, just in case we find a person who qualifies. Am I right?
We'll be canvassing for those positions, assuming the budget is approved, and filling them from lists.
Okay.
Yes.
Okay, good to hear.
Thank you, Mr. Chairman.
Oh, thank you. Mr. Grimm?
Thank you, Mr. Chairman. Just so I'm clear, the deputy commissioner position, which was 91,000, is being eliminated in your budget with the idea that you're creating an executive deputy commissioner in aging. Is that correct?
Right,
Okay. Well, and it looks like you're going from 91 to 78?
yes.
So you're saving 13,000 with the line, is that correct?
Right, with that, but there's more to the transaction than that, so there's other.
What more is there then?
I would like to just give it to you in a simple memo here, so it describes it, because I think there's 4 or 5 positions altogether that play out.
So it isn't just the executive deputy commissioners,
But
there's something else that's going on. What is that?
It's a larger plan.
I think the receptionist might be in there, the confidential secretary, but I'd like to at least put it down as one complete transaction, so you can see it.
Well, on the confidential secretary, we haven't named the commissioner yet. So how could you, in other words, you're offering this 8% pay raise without the commissioner being there. That strikes me as odd.
Okay.
Okay.
There you go. Mr. Miller?
I just want to make sure we're clear, the memo that you're going to provide us on this is also going to indicate what the functions are shifting over from DSS to aging?
And the reasons and.
Yeah, okay, fine. I just want to make sure it wasn't just positions and talk about the actual functions issue.
Mr. Bergdorf?
Just to kind of zoom back out to the macro level again, can you tell us a little bit about what your caseload trends are? Kind of where are you with TANF, food stamps?
Generally, in the budget book, you can see our trends for the last 6 years. But in some areas, we're going up, such as food stamps. We've increased quite a bit in food stamps. But in Medicaid, because of the transition from local management of Medicaid to some of Medicaid being managed at the state level, we've lost cases in Medicaid. So we've had a decrease in management of those cases, although we get a lot of phone calls still on those. And in temporary assistance, it looks like our family assistance, every month almost is different, but our family assistance is trending down, but our safety net is trending up. You can see in child support, our numbers continue to rise there. And adult protective, that is one area where we're seeing a pretty dramatic increase in the number of cases that we're responsible for being for guardianship responsibilities. And as you know, the population aging, we expect more of that in the future. So that is an area that we've experienced pretty dramatic increase in our responsibilities.
I guess what I was trying to get at was, given those trends, obviously you put together a budget that reflects dealing with that. But what are the programmatic dollars that follow those trends into the future? Are they ones that are from federal money, state money, or matching, or a county share?
We have a mix.
It's a bit of all three of those things, particularly with the safety net, is no state share, it's federal dollars, but there's also a large local share. But with like family assistance, where we're seeing a decrease in case load, it's 100% federal share. So there's no local share there. So it's a mix of, between the programs. Each of the programs are funded a little differently.
I guess what I'm asking is, for future trends, are there things that we have to watch for and to be aware of where the county share is going up without any sort of a revenue stream from the state or federal government? And if so, what are those areas?
Well, right. Safety net, as Joe just said, is a large county share, and we're finding people who, which is good because the economy must be doing better. We're having fewer people on the family assistance, but those people that are long-term and can't get off of assistance have multiple issues and maybe, larger families, et cetera, and they're on safety net for a little longer. That's more of our responsibility. We don't know, as was talked about earlier, what is going to happen at the federal level with Medicaid. That is going to impact, the future, but no one knows what's going to happen, if anything, with that federal participation in Medicaid. And as I said, adult services is also an area that we're very concerned about for now and in the future. And that, again, is a heavy county responsibility. There's a heavy county share on our adult services, our adult protective services.
Isn't foster care, we were cut $700,000 from the state this year?
That's,
And that's probably a trickle down from Washington.
Yeah.
The trend is not looking good with the current administration of what they're doing for social programs. That's a fact. So the outlook doesn't look good, Mr. Bergdorf, to answer your question. For at least 3 years. Any other questions? Mr. Higgins?
So is the welfare fraud investigator line currently vacant?
Where are we looking?
I'm looking
It could be.
What line item is it?
6010.
Page 1 of 17 in the handout, and it's the last line.
Oh, welfare fraud
Yeah,
investigator.
these are all vacant positions. This whole first page are vacant positions.
How long has that been vacant for?
Possibly up to 5 or 6 months. We made some offers and we got a rejection, so it's, back to canvassing again.
Okay. And this Medicaid fraud initiative in here on page 187, can you explain what that is?
Yeah, that's our contract with iPro to do Medicaid provider fraud audits. And also it has a component in it to pay for our maintenance and user for the Salient software that we use to do the research into Medicaid fraud.
Do we ever see any return on the iPro contract? Do they actually ever uncover any fraud that we find
They do.
and realize the revenue from?
And also that those funds are 100% reimbursed, but we do.
Interesting.
The tobacco settlement money, the $4 million, how are we spending that?
Well, it is part of the general fund.
Initially, it was the settlement was for education.
Direct dollar for dollar is the general fund revenue. I mean, it's part of the other 639 million. It's not directly earmarked for anything specific.
No, I thought when it was passed that it was specific to tobacco-related, unless I'm wrong.
No, it's supposed to be for healthcare costs.
Yeah.
Is it healthcare costs?
It's supposed to be for healthcare costs. That's
Look
what.
for it exactly.
Yeah, which,
It's part of it. We don't spend it.
Yeah.
It acts as a reduction to our local share in the MMIS account, but we're not responsible we don't get our hands on the money and write checks with it.
Right.
I can't hear you.
It reduces the Medicaid share. That's how we use it.
It's a reduction just to the local share of Medicaid. As far as what happens to the money once it goes into the general fund, I can't speak to that.
Let somebody find out.
We'll find out. Are there any other questions?
when does the tobacco settlement money end? Seems like it's been going on for.
We'll have to find that out.
People aren't smoking as much.
We'll have to find that out exactly. It's a few years down the road because counties are still selling their tobacco revenues.
It's based on tobacco sales.
Yeah.
Are there any questions? Thank you, Commissioner.
Thank you.
Next up, mental health, 155, page 155. Steve? Connors used to be all
Can't get in.
We want this reinvested.
Do you have anything in there? it's gonna be of any question.
Do you want to just talk about your budget, or you want us to just ask you a question?
Thank you, Mr. Chairman. Good evening, members of the committee and legislature. I'm here today with two members of my senior team. Kelly Roberts is our Associate Director for Fiscal Operations, and Susan Daly is the Deputy Director. Many of the concerns that have been expressed about healthcare in general in this country and state are impacting the Department of Mental Health as well. We are concerned about a lot of uncertainties moving forward. The fact is, some of you have heard me say before, business is brisk, and that is very unfortunate. We remain a safety net in this community. We provide a host of direct services, as many of you know, and we also contract through pass-through funding with dozens of behavioral health agencies in the addiction, mental health, and developmental disability arena. I'd be glad to answer any of your questions and expand on any of that, but that's pretty much what we continue to do, and I think we're doing a great job.
Thank you, Doctor. Mr. Kraus?
You mentioned here in the summary that the VAP grant funding
Yes.
from New York State OMH will end. What will the reduction be?
It's now going through 2018.
Right, well, two things, if I might. One is they've expanded the grant through 2018, and we didn't know that when we were preparing this.
So it will not end?
It will not. And that was a grant that was designed to help us maximize our efficiencies, upgrade our electronic health records, and develop some fiscal mechanisms to maximize our revenue. When that grant is over, I hope to be able to come to you and say we are operating at a much more effective and efficient manner, but the loss of that money won't affect the delivery of our services.
Does your budget as presented reflect the loss of that money? So we need to change that to consider that we won't lose that money in 18?
The expenses are in there. The expenses are in the budget. We could add the anticipated revenue that we thought was going to end. So there would be revenue.
There will be revenue that's
not in there.
We thought it would be over, and they extended it.
So you'll be able to provide
Yes.
us with that information?
Oh, let's get it to the office?
Sure.
That'd be great.
Sure.
Thank you.
Are there any other questions? Mr.
Chairman,
Grimm?
I noticed the consultant fees, there's a big jump from 34 to, it looks like 58,000.
That's associated with the VAP grant as well.
That's the finishing with the consultant, and the fees for services consultant line. That was, the plan was to finish up with the VAP consultant.
That's all money that we're receiving from OMH to do this multi-year improvement project. So
If it's multi-year, why was such a big jump between last year and this year?
Well, it came in stages, first of all. The first stage, this is a joint project that we have with our colleagues at DCYF, by the way. We upgraded our electronic health record in the first part of the grant. We brought consultants on site in the second year to work with us. They weren't here the first year, so that's why the cost has gone up.
What does BNNY stand for?
I'll give it my best shot. It's Behavioral Health for Northeastern New York, and it is a subsidiary of Albany Medical Center Hospital as part of the DSRIP initiative, part of the governor's Medicaid redesign initiative. So a lot of money came into New York State into healthcare. Much of it went downstate. Most of it went to health, not mental health, but some money has trickled down through local hospitals to programs like ours, and they've awarded us, I think what you're referring to, the ability to increase our mobile crisis team to a 24/7 operation. Their goal is to reduce, the governor's goal is to reduce hospitalizations by 25% in the emergency departments. So they saw our program as being worthwhile investing in, and this is really the first time we've done a public-private partnership like that, and we're pretty excited about that.
The decrease in inpatient hospitalization expense,
Yeah,
What, is that
yeah.
the new trend?
No, well, I like Director Slatke's term about fluid. I would say that's very fluid. We're responsible to the courts of this county to determine the competency of defendants to stand trial. And the law protects mentally ill people who don't understand what the proceedings are. If they're found not to be competent, they get sent to the state hospital system where they are restored to competency and they come back. We've seen that number much higher in recent years. We were fortunate that we were quite under budget this last year, and that really is just a fluid number. The DAs and the public defenders, they refer people to us to determine their competency, and it's simply, we're unable to predict exactly what that number will be.
Are there any other questions? Ms. Cunningham?
Just that the DSRIP dollars, so that means that OMH is part of the Albany Med DSRIP?
Well, so Albany, Albany Med, with all due respect to them, have come into the mental health field a little bit late, but they're kind of in the pilot seat. And so the Office of Mental Health is not involved in this particular project. Our county department is.
Okay.
But there are other initiatives that are happening around the state with DSRIP that may involve OMH.
Right. So my other question is, most of the challenge with mental health services is once an individual is identified, it's kind of matching them with the appropriate kind of caregiver in the mental health space.
Yes.
And because there's traditionally kind of shortages in the behavioral health sector, sometimes there's waits for services. Are you finding that in Albany County when an Albany County resident is identified? Are there long waits for services, or can you match folks that need the services that are eligible quickly with a mental health practitioner, or?
Right, that question basically guides our day-to-day operations. In our direct care services, we have our hands on the spigot, so to speak, and we can control that. The demand is very great, and we do not maintain a waiting list, ever. We've always taken the position that nothing good could happen with a waiting list. Now, having that said, there is a stipulated law that someone coming out of the hospital has to be seen within 5 days, and we meet that requirement. It's not, though, an immediate linkage. It would be within the 5 days. But we don't, we whenever possible, try to avoid putting people on a waiting list.
Okay.
Now, the dozens of contracts that I brought to the health committee the other night, we try to stay on top of that as best we can, and especially in the addiction side of things. When someone is ready, willing, and able to go into treatment, that's the last time you want a program to say, we'll see you in a week.
Right.
So our expectation is that there's immediate access, but of course, on any given day with any given patient, that may not be true. That's our expectation, though.
And are those contractors, are they measured on that among other factors about
Yes.
how quickly they're able
Yes,
to be
yes.
available?
Yes, most of those providers are licensed by the state, so the state has that oversight. We're in all of the programs that are not licensed at least once a year to measure and observe their functioning, and that's always something that we look at.
Okay, thank you.
Are there any other
And
questions?
may I also add that if anyone hears about waiting lists, I'd like to know about that, because we really are focused on minimizing that as best we can.
Mr. Grimm?
Yes, thank you, Mr. Chairman. On overtime, in the response you gave to Chairman Demolowitz, item 11, you list the overtime for 2015 is $8,900, 2016, $23,800, and 2017, $33,900.
Yeah.
So there's a marked increase, although it doesn't list what the 2018 projected overtime is. And if I go to your budget, the projected overtime line is $18,000. So
Right.
why we have the increase?
Right.
Am I correct that that's the projected number for
Yeah, yeah,
2018,
yeah.
and why we have the increase?
Yeah, I'd like to speak to it and then also ask my colleague to fix what I say. The main places that this is happening is in those areas where, as I say, we don't have control over the spigot. One of those is in our correctional facility. So we can't be coming to you and hiring people and then not needing them in 6 months. We use our existing staff to respond to the need, and there has been a precipitous climb in the jail work. The other part of where the overtime took place was on a mobile crisis team, and we had some vacancies that, irrespective of our staffing level, the calls come in, we have to respond, so we would pay overtime to the emergency workers who are on staff to meet that need. And our goal is to always have overtime as low as possible, but we also have to provide the service.
It's generally a result of vacancies.
But can you tell me, because in your communication, you list 2017's projected overtime, but what is the projected overtime for 2018? Because in your budget, it's 18,000, right? I suspect it's more than that, given the increases.
We anticipate it being 18,000. If there are vacancies during the year, then it could grow, and we would have to request a transfer. And you use unspent personal services to cover that.
Oh, so even though you've seen some sharp increases, including 33,000 this year, you're putting in for 18,000, but you're not quite sure that's going to be the number.
Again, I have to use the term that's fluid. If we're fully staffed, we feel that we're prepared to meet the need. If we're not, we'll need overtime, and if it comes at a time when demand has risen, it puts an extra pressure on us. But the demand is not a straight climb, so it's not always getting higher. It just so happens that the last 6 to 9 months have shown a precipitous jump.
Just to be clear, we're budgeting these positions so that you are fully staffed.
Yes.
You're just not filling these positions. We're having a hard time getting people to fill them.
I would characterize it as the latter, yes. To find people, for example, in our jail, we now have filled the social work vacancies. But I will tell you, that's not the most attractive job out there. So to find a social worker who is interested and willing and then able to do that work is very, very challenging. And as you've probably heard from other commissioners, we suffer the consequence of bringing young professionals, training them, getting them seasoned, and then they go right to the state where they get more money. So it is a challenge in the second category of finding eligible, capable people.
Ms. Cunningham.
Just to comment on that, the health and social services fields have vacancy rates that are only going to get worse.
Yeah.
If you want to advise someone who's a young person about a career that they will never have to look for a job, tell them to go into the health and social services, especially the behavioral health area. They will never have to look for a job. And if you want to check out the Bureau of Labor Statistics, I mean, it's kind of scary when you look at the demographics of the aging population and other.
Yeah, I would just say that is one of the main concerns that comes up in the Conference of Mental Hygiene Directors, my counterparts around the county, whenever we get, around the state, whenever we get together, workforce is the biggest challenge.
It is. Every healthcare organization in the country is talking.
In the business sector, that's a big challenge too.
Yeah.
Workforce, yeah.
Yeah, I noticed there's an increase in insurance expenses by 11,000. 11,000 to 73,000.
Yes, there's some med malpractice that has to be covered for the 2018 budget. We just went out and rebid that, or re-upped it last year, and that is the difference in the med mal.
Malpractice insurance went up that much?
10,000, yeah.
Wow.
Those are increases in premium, not paying out things that we.
60,000 it went up. $62,000.
What page?
I thought it was 10,000.
Page
Well,
157.
The number in this year's budget was.
Is that a typo?
That's a
We're
typo?
negative, yeah.
Yeah, let me get you the, that's,
Page 157, your line item A, 4310 account, 44037.
Yeah.
It went from 11,941 to 73,225.
But I think right now we're like a negative 47 or 48,000 in there.
you're like, the total's about 60 right now, right? Is what you're trying to say? Yeah, yes, that's a typo. Sent over a fix.
You'll correct that? Yeah. Are there any other questions? I'm sorry, Ms.
Yeah, I
McKnight.
have a question. I don't see the 12th tier of the psychiatric consultant agency here, and I was just wondering who's doing all the.
They are,
Supervisor number 5.
if you look at page 157,
He's on 157?
yeah, it's 4310, 44, 248 psychiatric care.
That's it?
Yeah, we put that into a separate line.
Okay, it's a separate
So,
line, yeah.
yeah.
So is he supervising the
Yeah.
5 psychiatric nurses, or they come up under your jurisdiction?
They're nurse practitioners and psychiatrists.
Okay.
We have nurses on our staff that are not part of that group, that are supervised by us.
Just speaking from the community, as we talk about all these people getting guns and causing havoc and social problems in our communities throughout America, but especially in Albany, in the inner city. And have you seen any rise in incidents where people are itching to buy guns who are described with a mental health disorder?
Well, that's something that every morning I look in the paper to check on.
Time
You know,
they didn't call you at night, huh?
no. It is a real concern. We, with the New York State SAFE Act, we get about 175 to 180 now reports each year into my office of people who have touched the mental health system, who shouldn't be having handguns. Problem is, the law doesn't include long guns, and people, I don't have a solution to that. I'm very aware of it, and that's always part of the safety plans when we, in our mobile crisis team, for example, 1,000 calls a year, we are often in situations with our local police partners taking guns away from people. That makes them very angry, though, and I hear
Are you still training the local police how to handle people who have mental disorders?
I am so glad you said that. One of the things that we're most proud of, if I might say, we finished our 6th class this last month.
Yes.
We have 170 local police officers, university police officers, correction officers, and probation officers that we've trained, and we have another program in the spring.
Okay, well, thank you, Mr. Chairman.
Thank you. Ally?
Oh, thank you very much. I just wanted to follow up on my colleague, Lucy McNick's question. Those reports that you get in, are those specifically for public employed or state employed, et cetera, psychologists, or are there people in private practice that are reporting right now?
Right. So the law requires the licensable category irrespective of where you work. And the hospitals mostly report, and the private community is hardly heard from.
Yeah, yeah. It's my understanding, just because I dealt with this a little bit, that because it involves I think it states it goes to, like report to your hospital or report to your, et cetera, that it basically ends up reporting as sort of a public entity, as it were, so we don't capture them. But I just wanted to...
No, it's true, and the other place we don't capture is the Veterans Hospital. It's like the Vatican. They are federal law, and you could have New York State licensed people working there, but they don't have to respond to the SAFE Act. And so that's always another element.
Interesting, thank you.
They're a self-contained world.
Are there any other questions? Thank you very much for coming.
Thank you, sir. I appreciate it.
Next one up will be Children's Services with the Youth Bureau, page 83.
We do fund provider bureaus, we fund provider funding for some of their programs, but they're not.
Are there any, Commissioner, welcome.
Good evening.
Do you want to give a brief statement, or would you just like to go into questions?
Sure. Myself, along with Maura Manning, Deputy Commissioner, are here to present the proposed budget for the 2018 Department for Children, Youth, and Families. The department is an integrated department of child-serving programs. It is inclusive of our Children's Services Division, our Division of Special Needs, our Children's Mental Health Clinic, the Youth Bureau, and we have 2 support divisions in terms of our staff development as well as our administrative services.
The majority of programs in our department are mandated services. Part of the challenge with that is then there are services and programs that we must support, and the costs associated with them are often not within our control. In 2017, we have seen an increase in programs and costs and services, and that continues to be a trend into 2018. In 2017, our appropriations were a little over $74 million. In 2018, we're anticipating it to be about $77 million, a little over $77 million. That being said, we have been able to not increase our local costs.
Are there any questions for the Commissioner? Mr. Signoracci.
On page 80, for the contractual expenses, the total line from the adjusted 2017 to the 2018 is increased by approximately $3 million. In line A, 2960-44038, travel, mileage, and freight. That increased by $400,000. The line below it, conference, training, and tuition, which is line A, 2960-44039, has increased by $2.8 million. And then the fees for service has increased by approximately $40,000. I guess one of the questions I have is those three lines. What are the reasons for the $3 million increase? Is it mandated? Is it not mandated? What are all of those, and how can you break those out, and what's the mandated costs?
So those programs do fall under the category of mandated. The travel, mileage, and freight speaks to the transportation. So for those children that are qualified for Committee for Preschool Services, as part of their programming, they're entitled to receive transportation. And so we have seen an increase in the number of children that are qualifying for programming, as well as the rates for those programs increase that we do not have control over. And so associated with that, with the increased number of children, we're seeing an increase in the cost of transportation.
Is that by the vendor, or is that by the amount of children?
The vendor does propose what the costs are, but it correlates because we do certainly have accountability built in. So it correlates because we're tracking the number of children that are going into the programs. So we do see the correlation in terms of the increase in the transportation costs based on the number of children that are going into the program. There are rules and regulations that govern the transportation, so you cannot have a child on a bus for more than an hour from the time that they are picked up to the time that they are dropped off at their program. So in terms of the number of children that can be on any one bus, that is one of the parameters that must be adhered to. We also, in terms of depending on the type of the bus, thank you. In terms of the disabilities of the youth that are being transported, there are regulations in terms of the number of monitors that must be on a bus, in terms of if you have a child that has any medical concerns, such as if they're in a wheelchair, or maybe they're considered medically fragile because they might have a tube or something along those lines. So there are different factors that go into the transportation costs. And with certainly the number of children, the increase in the number of children in the programs correlates with that. In terms of 2960-44039, the conferences, training, and tuition, that's the cost of the programs. So the actual center-based programs that these children are being enrolled in, we're seeing, again, an increase in the number. And again, we do not control the rates that's set by SCD, and so there are increased costs in terms of the rates of those programs as well. So that
SCD is?
State education.
Okay.
So that attributes to the cost, and I can provide numbers to, in regards to the numbers of children and the increase in the programs. So we have seen an increase from where in January of 2016, there were...
Do we have that in the backup? It's in the backup?
Oh, okay. It's not in this particular backup.
Oh, could you just send that to our office?
Sure, I can do that.
Okay, and then fees for service, I'm sure that is that additional?
That's another one of our programs. That's our special education itinerant teacher. So it's another service that if the child meets the eligibility criteria, we're mandated to provide that service. And again, we've seen an increase in the number of children who are qualifying for that service.
So, $3 million of mandated increases. Okay, so, next question is, the medical service therapy expense has been decreased by $300,000, which is the last one on A2960-44252. That's been decreased by $300,000. But the increase in revenue for the care for the physically handicapped, which is line A29644252 on page 80, how come the decrease in the service?
The decrease in the medical services therapy is the related services program, and so we're actually seeing more children who are being referred to center-based program as opposed to just the related services program.
But then there's a $2.4 million increase in the decrease in the physical handicap, which is A296003-277.
The revenue line here. So it's saying the increase from here to here, so it's an increase in revenue, so it's probably the reimbursement.
Oh, okay, thank you. Yes, that would be attributed to the reimbursements.
So that's the reimbursement, the loss?
Correct.
So that can kind of
Offset your top.
kind of offset almost the $3 million of increase.
Exactly.
That's the loss of reimbursement. Okay, let's see here. On page 86, halfway down the page, fees for service, A6119-44046 is decreased by $261,000.
337 to.
Yeah.
Went from 337 down to 75,000. How come the significant decrease?
1 second, please.
Yeah.
Yeah, they are.
Yeah, that's what I'm looking for. I know it's, yeah.
That's probably so useful.
Want to get back to us on that?
I can get back to you.
right.
It's either going to be associated with a grant or an encumbrance, but I want to be specific in my answer, so I can get back to you on that.
Sure, just
Okay.
get back to our office.
And then a few below secure detention, which is the 44402. That decreased by 300,000.
Yes, that's based on, we've seen a decrease in the cost in terms of the utilization at Secured. We've seen a decrease in the number of youth that have actually been placed there, and that's attributed to some of the detention alternative programming that we've been involved with.
How is the department preparing for the new youth detention requirements being mandated under the raised 18? And will this reduction reduce our ability to comply, or?
Well, right now, the state is saying that there's going to be 100% reimbursement for any of the costs associated with Raise the Age. So we're certainly looking at what we anticipate are going to be the costs in terms of the number of youth. It is going to be a staggered entry in terms of the 16-year-olds in October 1st of 2018, and then the 17-year-olds in October 1st of 2019. So we have some anticipated numbers at this point in time in terms of the youth that are expected. It is not a huge increase, but certainly we're anticipating that the 2018 into 2019 will certainly provide more information and some more concrete numbers of what that numbers will look like.
Okay. Another significant decrease is the 44404 adoption subsidies is decreased by 340,000.
Yes, unfortunately, that is because our numbers of adoptions decreased this year. We have a number of children that have been freed, but their cases are in appeals. So until those appeals are resolved, we're not able to get to the actual adoption. So that's what attributes to that decrease.
Okay. Skip back to page 81, the contractual expense for early intervention fees decreased from 2.2 million to 1.9. That's a reduction in 250,000.
Yes, actually, the state has taken over the administration of early intervention services, and we've just seen a decrease in the cost there.
And then the last two, page 81, from the count of employees, 27 to 25. And then on page 86, the same way, there's one less employee, so overall the department has 3 less employees. How is that?
Okay, so within 4059 on page 81, we have
The auditor and the supervisor.
the
of accounts.
auditor and the supervisor of accounts. So the supervisor of accounts is actually going to be reclassified as an account clerk 3, and the auditor is going to be reclassified as an account clerk 1. It aligns better with actual programs and services that needs to be facilitated with the Administrative Services Division, and it also nets a savings for the county in making these changes. And I'm sorry, what was the other page you referenced?
And then on page 86, shows that the count is down by 1. And that's, it's a staff social worker.
Staff social worker.
Oh, the staff social worker?
Yeah.
Yes. Yeah, that's what I mentioned. So as Director Giordano mentioned before, our departments are collaboratively involved in the VAP grant, and so as part of the consulting that they did for the department, they provided feedback that we did not need the number of staff social workers that we had, so we decreased it by 1.
Mrs. McKnight?
Yes, thank you, Mr. Chairman.
Mr. Sigarachi, you're finished?
At this time, yes, sir.
Thank you, sir.
Thank you.
Mrs. McKnight?
Yes, could you help us understand why the director of youth programs, the line item is empty?
That's your transfer
Page
out.
83, at
So
the
the rest
top,
of your
director of youth programs, does that say recreation account?
Yes.
Yes, and that's because they're now under the newly formed Recreation Department.
Oh, she is.
Newly formed.
Well, it was formed in 2017.
Relatively.
Relatively.
Any other questions? Mr. Kraus?
Thank you. Commissioner, in the correspondence that you sent back to the chair, you have a number of caseworker positions that are pending to be filled. It looks as though there are 8 of them, and then a staff social worker and 2 staff social workers also pending to be filled. Is this a normal occurrence on an annual basis, or is this rather large compared to past?
No, unfortunately, that is one of the trends that we're experiencing, but it's something across New York State when it comes to, especially the caseworker lines. There's just a high turnover rate. And so, what I will say is that we do work diligently once a line becomes vacant to fill that line. And so we're also looking at how to be able to build in some succession and some sustainability. But unfortunately, that is not an anomaly. It's pretty reflective of just the trend within the caseworker positions across New York State.
Are you losing these caseworkers to other agencies such as the state level, or are you just leaving the caseworker?
Primarily the state, in terms of what the state has to offer. That is definitely primarily the reason that we are losing staff.
Thank you. Thank you, Mr. Chairman.
Mrs. Sigarachi?
Again, on page 82, emergency aid to families, the fees for service A A6110444046, it's down on the bottom third of the page. That has a increase of about 610,000 for fees for services.
I'm sorry, could you give me that again?
A6110444046, the fees for service line. It's under the emergency aid families.
That's associated with our foster care costs. And again, we've seen an increase in the number of children coming into foster care. So whereas in years past, our numbers have been under 200, we're currently at 225.
So that's increased to foster care.
Which is interrelated. It includes our foster care block grant, the emergency aid to families, as well as the FFS.
Are there any other questions?
No?
Commissioner, your overtime line then doesn't reflect, you're at 453 and you were at 197, so your overtime line's going down.
Yes.
If you can't get the people, then how come it's going down?
How are we managing that? Well, in addition to the overtime line here, we also have, over the last 3 years, received enhanced funding from OCFS, and which we can utilize towards overtime. So between what's in our overtime line here and the funding that we receive through OCFS with enhanced CPS funding, we try to balance and keep our overtime costs down.
Sean, you know, we got to look at doing is in all the other departments in the budget, conferences, tuitions, and training are usually employees,
Yeah.
where yours isn't. Yours is, you got the
I think it
12
was set up
We got to
with the-
break that out some way for us?
It has come to our attention that that would be a very good thing to do. It is confusing in that manner. Some things we do not get to set the chart of accounts for. We piggyback off the state comptroller's chart of accounts. But we might want to look at changing that entirely to a different category.
Any other questions? Thank you, Commissioner.
Thank you.
Tomorrow night, same time, 5:30. Thank you all for your time for coming.